Hi today, it's the 15th of October. Today's video is about the problems trying to get mental health support from the service which is based within an A&E department, accident emergency, which is called Site Liaison, which is for mental health support. I'm confident this goes on everywhere. It's not just in my city. It's basically the bullshit structure of how it's been structured and put together. So basically, most of the time when you submit yourself to these services, you can't get any help. And I know for a fact that most people that come away from Site Liaison after being mentally health assessed come away with next to nothing, if not nothing. A lot of basic promises which do not get actioned. The promise of some pathway to a better sort of management of your mental health condition. Often, most of the time, this never gets actioned. And I'm going to explain some of the problems of what goes on with trying to access Site Liaison within A&E. Site Liaison is a side sort of thing within the A&E service. It's in every city. It's part of the A&E structure for people in mental health crisis. There are a couple of ways you can get to this. The police can take you to that Site Liaison. The ambulance service can. Or you can self-refer to Site Liaison. But the problem you have to go through the A&E department first, which is absolute bullshit. The problem is they've set it up so it causes you this problem, which I'm going to explain. So if you self-refer to Site Liaison, you have to rock up to the A&E department, wherever that is, whatever city. Well, mine's in the city of Exeter. And you were left to explain why you're attending. Not Site Liaison at that point. You have to explain why you're attending A&E. So you have to go through all this dribble of explaining why you're there. So you go up to A&E reception desk. You know, you have to explain that you're not here for an accident, physical harm, injury. You have to explain you're there for mental health support in a crisis. Well, this is structured this way basically to delay you being seen as a patient. Okay? And I will explain a bit later in the video how this can be improved. But they won't do this because this is the way it's structured to delay you getting help. It's also structured in the way to put you off, so you just give up and leave. So if you turn up at A&E in a mental health crisis wanting to see Site Liaison, you've got to go through the A&E procedure. Well, first off, the high chance and probability is when you turn up at A&E, it's stacked out the building. There's nowhere to sit. There's barely standing room. It's packed out, okay? Most of these people will be there for injuries, etc. Young children with illness. Elderly people who've had a fall, etc., etc. Okay? That's what it's set up for. So, you get there, you tell them you're in mental health crisis. They say that's fine. Take a seat. You will be seen by the triage service, which personally, for mental health, is an utter waste of time. The triage surgery is set up so if you go there with a sprained ankle or fractured leg, needing stitches, etc., or a child what's unwell, etc., the triage will assess which is the best path for you. The problem is when you turn up in a mental health crisis, that doesn't apply. Yeah, unless you've fallen over and injured yourself, but most of the time it doesn't apply. So there is no point you sat there for 3 hours plus or more to be seen by the person who's going to assess you, which is triage. Because all she's going to do, once she's worked out that you're not injured, she's going to refer you to Site Liaison. And Site Liaison is basically down the corridor, which is absolutely ridiculous. So then, she will assess you to see that you need to see site liaison mental health services and put you back in the waiting room. You could wait in that waiting room for another minimum to maximum 3 to 6, 7 hours plus. Okay? Then you'll get seen by site liaison and you'll be assessed. I'll leave that for another video, but basically you sit in that hospital potentially for hours and hours and hours with no support. Okay? And once you get a site liaison, the quick breakdown for this video is you'll get assessed and often you'll come out with absolutely sod all but a leaflet. All right, I'll get into that on another video, but this one's about accessing the service. So I said to the woman up there the other day, I said, this is absolute nonsense, it's ridiculous. She agreed. I said, why can't patients come in a crisis? Bear in mind, the site liaisons is literally down the corridor. They're on site. They don't have to call these people in, they're on site. And don't let anybody tell you any different, because it's just not true. They're there and they're in operation. All right? So I said to her, I said, common sense surely says, because you're not injured, you don't require stitches, you don't have a fractured ankle, etc. And when you come to A&E, you've already submitted yourself to the reception and said you're in a mental health crisis. If you just simply say you're not injured, why can't you just go down to another office or reception down the corridor, plenty of spare offices up there, you know, and go, oh, I'm here to sign on to site liaison. It's so simple. You just go there and sign on, I'm in a mental health crisis, I need to see site liaison. You go into that you know, that department and you take your turn and you wait and you be seen. And that takes the strain and the pressure off of accident and emergency. She agreed with me. She said, why isn't it like that? I do not know. I tell you why it's not like that. Because they want you to sit in A&E and wait for hours and hours and hours. Almost like a punishment. And they know, this is how it's structured, that quite often people with a mental health crisis can't tolerate sat in an A&E for 6, 7, 8 hours plus. Okay? So they often leave. And that suits them. They like that. They know out of 10 people, there's a percentage of people who will, after an hour or 2, 3 hours, will just leave. And they like that. They really do. So then those people potentially are out walking around in their mental health crisis, which is continuing, with no help. And often is the case, their situation deteriorates, they get picked up by the ambulance service, or they get picked up by the police. Worst case scenario, potentially they harm themselves further. It's all bullshit. This is how it's structured. So, and I know many people have had exactly the same experience. They need to change A&E so you can go directly to the site liaison department, sign on at a reception desk that you're in crisis and you need support in a separate waiting area. It's not about jumping queues before anyone says, oh, will you be jumping the queue? It's nothing to do with that. It's sending you to the right department to deal with you. And cut out all that bullshit which they've put in place. But they won't do that. Because they want that buffer system where you sit in another department and get fucked about. Okay? And then they know that some people will just walk out. It's a shit service and it provides no help. My other video will be about some of this when they give you the limited help. How it doesn't get relayed through to mental health services like a CMHT. I'll put that in another video. So that's about it. That's what happens. That's what takes place. I've spoke to many people. They're absolutely, totally frustrated with it. They feel they're not being heard fairly and they're not being treated fairly. This is the setup of site liaison. It's bullshit.